We'll go ahead and get rolling. And I just want to thank everybody for joining us today. If you joined our last webinar that we had before this one, it was Social Security. We have Medicare today. Those are typically our two most popular topics for webinars. I think folks always have questions about it. Every year there's a new crop of folks who are either opting into Social Security or eligible for Medicare. So really excited about this webinar. I think we're going to have some great information that's covered today. Before we get into that, and before I introduce Brandon and Michael, I am going to just share a little bit of information about who Cornerstone is, because there's a good chance you may not know anything about Cornerstone. I'm Bill Friebel. I'm the president of Cornerstone. So Cornerstone Wealth Management is a registered investment advisor based in St. Louis, Missouri. We have about 129 financial advisors scattered amongst 15 states. We have about $11.5 billion in total assets under management. And as I said before, the reason why many of you who are joining us today maybe don't know who Cornerstone is, it's because your advisor is branding as something completely different than Cornerstone. They may brand as LifeMap Wealth Management up in Decatur, Illinois, or Triada in Columbia, Illinois, or Planify based here in St. Louis, or Vine Wealth Management, or Strong Path Wealth Management down in Springfield, Missouri. But again, advisors all across the country. We have about 70,000 client accounts that we work with. But again, your advisor in many cases has chosen to brand on their own, but still affiliate with Cornerstone, because we'll do things like this webinar. We do things for them. We provide services to them. We provide a community where they can share ideas of best practices. Maybe they can gain greater skill than what they might have on their own. But in addition to that, all of our advisors use LPL Financial as their broker dealer. That's the company that sends you your statements. It's the company that provides a lot of our technology that we use, our cybersecurity. And in addition to that, it provides the product shelf, if you will, for your advisors to solve your financial needs. If you're not familiar with LPL Financial, LPL is the largest independent broker dealer in the country. They have over 33,000 financial advisors, which is actually larger than a lot of the bigger name firms that you see advertising on TV. They have over $2 trillion in client assets. But again, it is structured as an independent broker dealer, which allows your financial advisor to really provide you with financial solutions with no bias or no incentives to use one product over the other. It's really just meant to provide you with the best opportunity. How that all fits together for you is really that support from Cornerstone, that scale of LPL, but then also that additional structure that we provide that just allows your advisor to spend more time with you, and really provide you with the highest experience, the highest client service that they can absolutely provide. Just a bit of a house cleaning note before we get started today. Unfortunately, we cannot use the chat function or the messaging function inside the Zoom webinar. So that being said, if you do have questions that you would like to ask, you do have to email those. The email address is cornerstonewm, no spaces, no dashes. So cornerstonewm@lpl.com. And I'll mention that once again. We'll mention it at the end of the presentation so you can ask away. But again, that's cornerstonewm@lpl.com. I am going to jump off the screen in just a moment here. I'll come back on at the end. When you send those questions in, they do come to me, and I will then ask on your behalf. So again, that's the way the process will work. Let's go ahead and get started with the main attraction, which is the discussion around Medicare today. And I'm really pleased to have both Brandon and Michael Graham. You might notice they share a last name together. That is a father and son duo. Michael is the president of Comprehensive Benefits. Brandon is director of operations and a partner at Comprehensive Benefits. But Brandon is going to be sharing with us a lot of the information today. And he spent the last 10 years, really serving Medicare clients and agents who support them and he works directly with clients to identify Medicare coverage suited to their needs while overseeing compliance, product training, marketing, and business development for more than 70 independent insurance agencies across the Midwest. So, Brandon, I really appreciate you being here. I know you have a lot of great things to share with us about a very, very, as I mentioned before, popular topic, which is Medicare. So, why don't I turn things over to you and let you take it away?
Sounds great, Bill. I really appreciate it. So while I'm getting my slide deck pulled up, um, like Bill was saying, my name's Brandon Graham with Comprehensive Benefits. So our agency is also located in St. Louis, just like Cornerstone. I've been working with this team for the last 10 years. I have a very interesting role here. I get to work with Medicare members every day. I do have a book of business that I serve. I also get to work with over 70 independent agents and agencies across the Midwest that Comprehensive Benefits serves when it comes to compliance, marketing support, training, um, making sure that those agents and agencies are operating compliantly, effectively, have truthful marketing out in the industry. So I get to work both sides of the industry. I get to train agents and agencies to make sure they're working with their clients in the best way possible. I also get to work with clients one-on-one, um, to make those things happen myself. So I feel lucky in that regard. Um, so to get started, this will be Medicare 101, kind of a high level overview of the federal Medicare program. And like Bill said, any questions, please don't hesitate to reach out and we'll go through those at the end. So to start, who is eligible for Medicare? So the federal Medicare program, when you turn 65 or qualify due to disability, so typically you can qualify for Medicare after 24 months of a qualifying disability event, or at any stage of life if you are diagnosed with end-stage renal disease or ALS. Most of the time, folks will qualify for Medicare when they turn 65, um, and we do see it quite often, after those 24 months of disability. You do have to be a qualified resident of the United States as well for more than 5 consecutive years to qualify for Medicare. So enrolling in Medicare is always one of those confusing topics, especially when we work with folks who are leaving, leaving employment, retiring, same kind of conversation with Social Security. You're leaving your employer group. What do I do with my Medicare? How do I handle it? I get lots of mailers talking about penalties and um, how do we handle this enrollment situation? When you turn 65, if you are currently drawing Social Security, Social Security is going to assume that, well, if they're drawing Social Security, they're probably retired. They will automatically set up both Medicare Parts A and Part B to go effective the month that you turn 65. Let's say somebody's drawing Social Security and they're still on employer group coverage. That may be a situation where you need to proactively delay your Medicare enrollment. So it's something to pay attention to. But for the most part, if you're on Social Security or if you're on a federal health program, so something through the ACA, Obamacare, you will automatically be signed up for Medicare Parts A and Part B when you first turn 65. If you're not drawing Social Security when you turn 65, you will need to actively take steps to enroll in Medicare Part B. Those steps are very easy. Typically, what I advise folks to do is talk to a broker, figure out what your situation is. Do I need to sign up for Medicare Part B now, or is it something I can delay? And once you've made the determination that it makes the most sense in your situation to sign up, it's easy to do by going to socialsecurity.gov, doing it over the phone or at your local Social Security office is where most folks will um, do that the easiest. So at a high level, this is one of my favorite slides that I ever go over with folks because as confusing as all of the marketing is surrounding Medicare, A, B, C, D, E, F, G, the whole alphabet, um, it a lot of that is marketing designed to, I don't want to say confuse folks, but to drive engagement, get folks to call into those TV commercials. Medicare itself is a lot simpler than is perceived, I think, by a lot of Medicare members. The federal Medicare program, so original Medicare, is made up of two parts, Medicare Part A and Medicare Part B. That's your federal Medicare benefit that makes up original Medicare. And then once you have decided that Medicare makes the most sense for you moving forward, you have really two distinct options, possibly three if we have something offered through a former employer. But for most folks, you've got two options. Do I look at a Medicare supplement policy with a standalone prescription drug plan, or do I look at a Medicare Advantage plan, otherwise known as Part C, that may combine the prescription drug, the medical benefits, and some additional services outside of what Medicare originally covers? So in my opinion, if a Medicare recipient can really wrap their head around this slide, what is the difference between a supplement and prescription drug plan? What is the difference between a Medicare Advantage plan? It'll serve you, the member, um, more than just about anything else in your time on Medicare. You can understand the differences in the two product types. It really clears up all of the marketing and the confusion that's out there. So, original Medicare Part A. Medicare Part A is through the federal Medicare program. You're automatically signed up when you first become Medicare eligible. So at age 65, even if you are still working, still covered under your employer group coverage, you're automatically going to be entitled to Medicare Part A. Medicare Part A, for most people, does not include a monthly premium. I think that's our next slide. Maybe I'm jumping ahead. Yep. For most folks, Medicare Part A does not include a monthly premium. You're not paying anything for Medicare Part A. As long as you've worked 40 quarters and paid into that Social Security tax program. Uh, 40 quarters is working 10 years. If somebody has worked less than those 40 quarters, they will add a monthly premium to Medicare Part A. Again, for anybody that's paid taxes for more than 10 years, should qualify for that premium-free Part A. And then to jump back a slide, what is Part A? Well, Part A is going to generally, at a high level, cover roughly 80% of the costs associated with inpatient hospitalization. So, original Medicare does consist of some deductibles, some co-insurances. At a high level, though, your 80% original Medicare is going to cover about 80% of your overall uh, Medicare approved healthcare needs. With Part A, it's 80% of your hospital needs. So inpatient hospital care, skilled nursing, hospice, home health care, those are all services covered under uh, original Medicare Part A. And again, we covered the premiums for Part A. Most folks are not paying a monthly premium for Medicare. Again, if you're working past age 65 and we've delayed Medicare Part B, you are still entitled to Part A, uh, and it can be turned on retroactive. This is something I get a lot of questions from clients about. Hey, if I'm working past age 65 and I'm still on my employer's coverage, I don't have a Medicare card. Do I need to sign up for Part A? I will usually tell folks, no, you don't need to actively sign up for Part A because you are entitled to it, and it can go effective retroactively up to 6 months. So if there ever was a situation where you're still covered under employer group coverage and may have gotten more coverage out of original Medicare Part A, that can be turned on retroactively and coordinate with that. So I tell folks, don't stress too much about Part A. Our real deciding factor on whether we make the jump from employer group to Medicare is discussion. And what does Medicare Part B cover? So Medicare Part B is your medical portion of Medicare. Part A, hospital. Part B, uh, medical services, provider visits, doctor preventative health screenings, specialists, outpatient surgeries, diagnostic screenings, durable medical equipment, injections done at the doctor's office or outpatient. These are all services covered by Medicare Part B. Folks who opt to stay in Medicare Part B do again have deductible. There are some co-insurances, but at a high level, if you look at it over the course of a year, both Part A and Part B are going to cover about 80% of your out-of-pocket health costs associated with hospitalizations on Part A and medical um, services. And Medicare Part B does have a monthly premium. So when folks are making the decision when to sign up for Medicare, it usually revolves around our employer group coverage, our age, what are we currently paying for insurance? Does it make sense to sign up now? Does it make sense to delay? Have those conversations. The standard Medicare Part B premium this year is $202.90. This is going to be the standard monthly premium. I think they said this will be the premium for 93% of Americans. About 7% of Americans, though, will receive what's called an IRMA, or an income-related monthly adjustable amount. It's a mouthful. But that monthly IRMA is an income-related adjustment made to what somebody pays for their Medicare Part B premium. So higher income earners will wind up paying a higher Medicare Part B premium than folks that fall into that standard Part B premium rate class. As you can see, for folks filing individually, $109,000 on an individual tax return, $218,000 on a joint tax return is that threshold where if we go over that, it will push us into higher bracket for our Medicare Part B. That premium is always based on your Social Security or your income tax returns filed 2 years prior. So if somebody is, let's just hypothetically, somebody's turning 65 next month in August of 2026, their Medicare Part B premium is going to be based on their income tax filings in 2024. Their Medicare Part B premium in 2027 will be based on their income tax filings in 2025. So there is a trail. If our income goes down in retirement, for most folks it does, that Part B premium is a 2 year trail, but it will go down as income goes down throughout retirement. So as you approach Medicare eligibility, there is a lot of marketing about penalties. It's a really great way to get folks to call in, ask questions, figure out what they may need to do. Medicare Part B does have a late enrollment penalty for people who are eligible for Medicare Part B and opt not to enroll in it when they don't have something that's considered uh, otherwise creditable coverage. So what that means for most people is if you're still working past age 65, let's say we're 67, we're still covered under employer group coverage. If your employer group has more than 20 employees, is typically the cutoff for that creditable coverage threshold. More than 20 employees will typically mean your employer group coverage is considered creditable with Medicare, and it allows you to delay enrollment in Medicare Part B without a penalty. If, let's use that same example, a slightly different example. Somebody is turning 65 and they just don't want to pay their Medicare Part B premium, don't feel they need the coverage. If they don't have otherwise credible coverage, going back to when they first turned 65, once they do sign up for Medicare, Medicare will apply a 10% penalty for each 12-month penalty, 12-month period that you went without Part B after you qualified. So that is a scenario where it's always a good idea at age 65 to talk to somebody and just figure out, am I making sure I avoid the penalty, whether I sign up for an individual Medicare policy now or stay on my employer for the next 10 years. So original Medicare, again, generally covers about 80% of the cost for hospitalization and medical expenses. again, like I said, original Medicare does have things like deductibles, co-insurances, co-pays. Some things original Medicare does not cover are things like prescription drugs. Uh, Medicare will penalize you for going too long without prescription drug coverage, but they don't provide that prescription drug coverage through the federal Medicare program. Uh, Hearing aids, exams, screenings, routine eye exams, routine dental. Those are some places where Medicare itself does have some holes. So those are places where folks will look for outside insurance products to address some of those needs. So if we go back to that chart, you know, somebody's got original Medicare. They're now covered 80% on hospitalization and medical needs. They're looking to figure out what's the best way for me, a Medicare recipient, to cover that 20% remaining out-of-pocket exposure that I have through original Medicare. The one of the downsides with traditional Medicare is there's no out-of-pocket cap on that 20%. So original Medicare does a great job. But if somebody has an extremely rough year, very high medical out-of-pocket costs, that Medicare 20% out-of-pocket can keep growing because there is no what's called a maximum out-of-pocket cap on your overall medical expenses. That's where a Medicare supplement policy or a Medigap policy can come into play. So the way a Medicare supplement or Medigap policy works is when you sign up for Medicare, your Medicare is covering 80%. You have the option to sign up for what's called a Medicare supplement policy. And the way those Medicare supplement policies work is you pay your monthly premium. They do have a monthly premium. And those policies are going to turn around. And when original Medicare pays out a claim and they pay out their 80%, that Medicare supplement policy is going to turn around and fill the remaining 20% cap. So it's a very straightforward type of coverage. We're still on original Medicare. You have the freedom to choose any doctor or hospital that works with Medicare in the United States. It's 99.9, I don't know the actual percentage, but no network. These plans are standardized. So there are lots of different letters. A lot of folks hear the Medicare alphabet soup. Um, there are lots of different Medicare supplement policies that are built on a standardized design platform set up by Medicare. The most common supplement plans right now that we see are Plan G, uh, and then some folks do still have what's called a Plan F in the market. The way those plans work, again, original Medicare is covering 80%. Your supplements turn around paying the 20% remainder. Plan G, which is right now one of the more popular types of Medicare supplement policies. The way that works is you agree to meet your Medicare Part B deductible each year, which this year is $208, 200, I think it's 208.90. Once you've met that Part B deductible, you have that 20% remainder left for you, the member, is going to be picked up in full by that supplemental. So easy way to think about Medicare supplement policies is I'm paying a higher monthly premium each month, but I know whether I go to the doctor twice a year, 200 times a year, I'm going to have roughly the same out-of-pocket expenses associated with my healthcare. Because once I've paid my premium every month and I've met that Part B deductible, I should be receiving zero bills for any out-of-pocket medical services. So paying a little bit more each month for coverage, but you have no network flexibility to see any Medicare doctor or hospital in the United States. And we don't have many of the prior authorization uh, processes that folks are used to with traditional insurance plans, especially things folks may have. These plans are standardized, so a Plan G or a Plan F is going to be exactly the same coverage regardless of insurance carrier. Big difference from carrier to carrier is going to be what their monthly premium is in that market. So what don't Medicare supplement cover? Well, Medicare supplements do not cover prescription drugs. So when we set up a Medicare supplement policy, we also want to make sure we're setting up a standalone prescription drug plan, make sure that we've got credible drug coverage under Medicare. Even if somebody's taking no prescription medications, I advise folks to sign up for a prescription drug plan just to avoid that Part D penalty in the future. There are some very low cost prescription plans. I know here in Missouri and Illinois, we have some $6, $0 a month. Uh, and so this is a plan where for most people, it's very easy to work with an agent where we'll take your list of medications, plug them into Medicare system, and it will just kind of sort based on your list of meds, which prescription drug plan is going to have the lowest overall out-of-pocket cost over the course of the year. So these are very easy for us to set up, but it is one thing that is not going to be covered under original Medicare and thus not picked up by that supplemental. So with a Part D prescription drug plan, you do have to have original Medicare Part A and Part B. Uh, well, you have to have Medicare Part A and or Medicare Part B to enroll in a standalone drug plan. There are penalties for folks who are eligible for Medicare and go longer than 63 days without creditable coverage. So that's why making sure we're addressing this, around age 65 or when we're retiring is very important. Prescription drug coverage can also be built in and incorporated into a Medicare Advantage plan. We'll talk a little bit more about those Medicare Advantage plans. The way they work is they kind of combine a lot of the benefits covered under original Medicare, Part D, and offer them in a more holistic bind package. And then prescription drug coverage information. You should know exactly what you're going to be, or very close to what you'll be paying for your prescription drugs throughout the year based on the plan's design and estimating when you go ahead and set that up. And again, here's that Part D late enrollment penalty. So if somebody, after they're first eligible for Medicare and does not have credible coverage, if they go longer than 63 consecutive days without credible drug coverage, Medicare will start to assess a penalty, 1% of the national base premium, multiplied by the number of months that you were uncovered while you were eligible for Medicare. So, if we're only uncovered for a few months, that penalty is not going to add up exorbitant, but it does stick with you for life. So that monthly premium is applied to every prescription drug that you make for the rest of your life. So avoiding that annoyance is worth the trouble of dealing your coverage headache. Medicare did change up the way prescription drugs have been covered in the last couple of years. For years, we had to really try to explain this nebulous concept called donut hole. I'm sure some folks on the call will understand what I'm talking about. Where in the past, folks, Medicare prescription drug costs throughout the year went off. They would jump around depending on what stage of their Medicare coverage they were in. That's been streamlined a little bit. There are 3 stages of Medicare prescription drug coverage now. They did get rid of that coverage gap or the donut that people were. So the stages of a Medicare prescription drug plan are stage 1 is your deductible stage. Most folks, generic medications will fall outside of the deductible. If you have brand name medications, these are the meds that will go towards a plan's deductible, just depending on which prescription drug plan we initiate with. Once that prescription drug deductible has been met, or if your medications don't warrant going towards the deductible, then you have them covered through stage 2 or your initial coverage. In your initial coverage phase, each medication is broken into a tier. So tier 1 would be preferred generics, tier 2 generics, tier 3 preferred brand name, tier 4 non-preferred brand name, and tier 5 is special. Here, depending on which prescription drug plan we go with, is assigned a different either copay or coinsurance. So as a member is making their copays and coinsurances based on the prescription they have, if they, in 2026, their true out-of-pocket cost on medications ever reaches $1,100, that acts as a cap on their overall out-of-pocket prescription drug costs. After you've reached that $2,100 true out-of-pocket cap on prescription drugs, you move into that stage 3, where your prescription drug costs, as long as they're covered by the prescription drug plan, go down to zero for the remainder of the year. That $2,100 maximum out-of-pocket cap essentially means that as long as somebody makes sure that they're in a prescription drug plan that covers all of their medications, anybody on Medicare should not pay out more than $2,100 in a given year for prescription drugs. That $2,100 too is a little hard to calculate because it's not $2,100 out of the member's pocket. So it's not when the member pays out $2,100, it's when the true cost of the medication reaches $2,100. So for a lot of individuals, you can wind up getting into that stage 3 catastrophic coverage without actually paying out $2,100 of your own money because they're factoring it based on the what the insurance company is paying for the prescription, essentially. So let's say Acme Insurance Company is offering coverage for a prescription drug, and the retail cost of that prescription drug is $50. They've negotiated down to $40 with the manufacturer. That $40 is what goes towards that $2,100 cap, even if your copay on that specific medication may be $5. So this is something where if you sit down with somebody and go through this at the beginning of the year or during that annual enrollment period, every year when the plans change, they should be able to give you a close estimate. Hey, if we fill each of these meds once a month based on the list we currently have, each month this is about what we should be expecting to pay on each medication and what stage we should be at any point of the year. And then when it comes to saving on prescription drug costs, there's a federal program called LIS or Extra Help for seniors on Medicare. This is a program that can sign up for. There are some asset limits, but you have the ability to sign up in it's a federal program. So if you're eligible, it does help offset some of your prescription drug costs covered under Medicare Part A. So when you apply, they do look for, assets. There are some strict asset limits. Then they look for, there are non-countable assets. So they'll go through, figure out what's countable. And then if you do qualify for LIS or extra help, it does greatly reduce your monthly out-of-pocket cost on those prescriptions. This is something that for most people, when you first sign up for Medicare, if Social Security, as they're figuring out your Part B premium, if they determine that your income qualifies you for that LIS program, most of the time, folks are enrolled automatically. Very rarely does somebody need to proactively enroll in Medicare Extra Help program or LIS. So we've covered the first side of the Medicare coin, I guess. Option one, when we qualify for Medicare, is to go with a supplement plan and standalone drug plan. Option two on Medicare is to go with a Medicare Advantage plan. To back up, I don't think I covered it, but I want to make sure I touch on one last thing with Medicare supplement policies before I jump into plans. A member's only time that they're guaranteed to be accepted into a Medicare supplement policy is when you first become Medicare eligible. Uh, so the way Medicare looks at these supplements is you have 6 months after the time your Medicare Part B went into effect to enroll in a Medicare supplement policy without going through medical health. Somebody opts to enroll in a Medicare supplement policy. Let's say they've been on Medicare for 2 or 3 years and now they want to sign up for a supplement policy. That company will ask you to go through medical health underwriting, and folks can be denied for that coverage based on uh, you know, preconditions or past health history, things like that. So that is one thing I just want to make sure that I touched on before I talk about Advantage plans. I want to make sure folks are aware that supplements, your only time you're guaranteed to be accepted when you first become Medicare eligible. Medicare Advantage on the other side of the Medicare landscape. These plans are offered by private insurance companies and they're approved by the federal Medicare program as an alternative option. You do have to continue to pay your Medicare Part B premium. You do have to continue to maintain enrollment in the federal Medicare program. But the way these plans work at a high level, um, just to simplify a little bit, the federal government every year sets aside X amount of dollars for each Medicare recipient. When these Medicare Advantage plans come to market, they are held to a very strict criteria of guidelines as to what Medicare needs them to do in order to maintain their ability to offer a plan in the market. And so, when you think about it, the federal Medicare program, it really does not make sense for them to give a private insurance carrier the funds that they have set aside for your healthcare through Medicare to fund it through an alternative policy, unless that private company can show that their members are having better overall health outcomes than folks who opt to stay with just traditional Medicare. So I don't know if I did a great job explaining that, but in a roundabout way, these are plans that are designed by private companies as an alternative to the federal Medicare program. So these plans, the criteria that they have to meet, uh, they have to make sure that their members have a cap on overall out-of-pocket expenses, something original Medicare does not have. Their members have to show that they have better overall health outcomes than folks covered on just original Medicare, better prescription drug adherence, fewer hospital readmissions, member satisfaction have to say exceptionally high. So in order for Medicare to continue funding these plans, they do need to continually show that their members are experiencing better overall health outcomes than folks who opt to not enroll in Medicare in a supplement, but in just traditional Medicare. So, enrollment periods. When can we sign up? What do we need to do? When somebody turns 65, they have a 7-month window, 3 months before, month of, and 3 months after their birthday, to enroll in original Medicare. Outside of that initial enrollment period, there are lots of special enrollment periods that can allow somebody to enroll in original Medicare. Things like leaving my employer group coverage, I'm retiring. Uh, a move triggers a special election. Uh, Natural disasters a lot of times can trigger special election periods. So there are ways that folks can make changes outside of either their initial enrollment period or that annual election. And then when it comes to the Medicare Advantage plans and standalone prescription drug plans, your times of the year to change are typically going to be the annual enrollment period, October 15th through December 7th, and the open enrollment period, so January 1st through March 31st. That open enrollment period is really designed I always tell clients it's a whoopsie enrollment period. It was set up by Medicare to allow folks who may have uh, made the wrong choice in a policy during the annual enrollment period to fix it in January, or let's say they had a medication that they didn't check in the fall and now they're having an issue with it in January. They do give you those first 3 months of the year to make adjustments to your policy as well. And then Medicare supplement enrollment periods. Touched on this a little bit earlier, but you do have a 6-month window that begins on your Part B effective date, or your 60th birthday, whichever is later. And during that initial 6-month window, you have no medical underwriting. You can choose any Medicare supplement. Uh, Back on Medicare supplement policies. So, they will put somebody through medical health underwriting if they're enrolling outside of that age 65. There are quite a few states that if somebody's on a Medicare supplement policy and let's say their premium has increased to a place where they're not comfortable, some states do have different guaranteed issue situations that can allow folks to sign up for that Medicare supplement policy by, and avoid that medical health underwriting. In Missouri, we have something called the anniversary rule. If somebody's on a Medicare supplement and make a change every year on the anniversary of when that policy went into effect without answering any health underwriting questions. If somebody's policy, somebody's on a Medicare Advantage plan and that policy leaves the market, that triggers a special enrollment period. Sign up for a supplement policy without health underwriting. If you don't qualify for a guarantee issue situation when signing up for a Medicare supplement policy, that is when you will have to go through medical underwriting on Medicare supplements is not, you don't have a medical visit, you're not doing a blood draw. It's just a series of questions that you do verbally with the agent. But, based on our health history, we can be denied that policy. And then star ratings. So there's inside the industry, there's been a lot of conversation the last couple of years surrounding star ratings. Every Medicare Advantage and prescription drug plan is assigned a star rating from 1 to 5 stars annually. So remember when I was talking about Medicare and their ability to fund these plans? They track all of these. If Medicare's sending a private insurance carrier money to facilitate a Medicare health plan, they want to make sure that that plan is spending all of the money the right way. And then the member is meeting those performance metrics. So member satisfaction surveys are very important to these plans. They send those out every fall. Those go to Medicare, and those determine the Part D or the Medicare Advantage plan's funding. It's very closely tied to their star rating. Member satisfaction, speed of paying claims, provider satisfaction. And then there are 40 key metrics that Medicare looks at to evaluate how they grade those prescription drug and the Medicare Advantage plans. When it comes to the star ratings, if a policy earns a 5-star rating, they have the ability to take enrollments at any time of the year. So it's a very big financial incentive for these plans to achieve a 5-star rating, because then instead of only being able to enroll new folks during an 8-month or an 8-week period during the fall, they could take enrollments all year round. If a plan ever falls below a 3-star rating, its members are allowed to leave that plan at any time of the year. So Medicare really wants to make sure that if somebody's in either a prescription drug or a Medicare Advantage plan that's contracted with the federal government, we're holding them to a very high standard if we're going to be allowing a private company to administrate this benefit. And then, not really specifically my services to you, but what should you be looking for in somebody that you work with on Medicare? I'd be happy to answer anybody's questions. I personally am licensed in Missouri and Illinois. We have agents that are licensed in, I believe, 6 different states. Really, it's important to work with, I tell everybody, find somebody that works as a broker, because a little inside baseball, insurance professionals are compensated for helping folks enroll in insurance products. Medicare, just like it standardizes many of the product designs and the plan designs, they also standardize the way they compensate insurance agents. So if you work with an insurance broker, they should not be receiving any more compensation depending on what policy they enroll you in. When it comes to these federally mandated plans, it's a standardized amount of money that is paid to the agent. So I tell folks it's in your best interest to work with a broker because personally, as a broker, I don't really care what policy somebody goes with. It makes me the same amount of money. My goal is to make sure that they enroll in a policy that fits their needs so that they want to continue to work with me year over year. As long as they've got a plan that's meeting their needs, I'm happy, they're happy. It makes for a very good long-term relationship. So I tell folks, look for a broker. Um, they should be impartial when it comes to all of the products available in your area. And then you want to make sure that somebody's appropriately licensed, certified. And I would make sure that whoever you're working with is licensed and appointed to work with both product lines, both Medicare Advantage and Medicare Supplement plans. There are agents and groups that only offer one or the other. Comprehensive benefits, we're about 50-50. So you want to make sure that whoever you're working with is going to accurately show you both sides of uh, your Medicare options and go through what may make the most sense for your specific situation. Personally, I've run into many situations where we'll have a husband and wife couple where one spouse may go with a supplement, another an advantage plan. So kind of wrap things up a little bit. You've got a lot of options when it comes to your Medicare coverage. If you're still working past age 65, you have the ability to stay on your employer's group plan as long as it's considered credible employees. Uh, you can continue if you have a retiree plan. Um, so like a lot of larger corporations will design a group Medicare Advantage product for their retirees. Um, or TRICARE, VA services, those are things that may, may not need to sign up for Medicare or some of these different products if they are enrolled in TRICARE for Life or utilizing the VA. Uh, so you can stay on employer coverage, utilize retiree or military coverage, enroll in a Medicare Advantage policy that includes prescription drug coverage, or you could enroll in a Medicare supplement policy and a prescription drug plan in tandem. Simplified, those are the four routes that I'm going to say 99.99% of your Medicare retirees are going to fall into one of those four uh, categories as to how they receive their health care. During an appointment, you want to make sure that you've got a list of your doctors. For me to be the most helpful I can be, having a list of your providers to make sure we're checking provider networks or in case of supplement, just make sure doctors are still available and able to take new patients. Uh, Checking providers and medications is the most important thing to make sure that your coverage is going to be as consistent as possible. Uh, Deciding factors, it is very individual. Medicare Advantage plans and supplements do vary quite a bit depending on location, state by state. There are certain markets that are very supplement heavy. There are certain markets that are very Medicare Advantage heavy. And so it is important to really look at both options and understand in your market uh, what both of those options looks like. And then if you have any questions, I've thrown my contact information up here. you can always reach out to Cornerstone as well, and they'll make sure that you get in contact with whoever will make the most sense to help uh, with this Medicare situation. But really, to put a bow on things, Medicare is not as complicated as a lot of the marketing, uh, a lot of the news we've seen in the last couple of years surrounding healthcare, and it's a lot simpler than folks make it out to seem. Um, as long as you understand those four different routes that most wind up taking. So again, Bill, I really appreciate you allowing us to do this today. Uh, were there any questions that we had came through?
Yeah, actually, and thank you, Brandon. We appreciate you being here and sharing all your knowledge on something that can be a fairly intimidating decision for a lot of folks. And I do have a few questions that have already come in. And just as a reminder, if you do have a question that has to be emailed, the email will come to me and then I'll ask on your behalf. But the email address is cornerstonewm, again, no spaces, no dashes, cornerstonewm at lpl.com. So if you do have questions, please fire away. And Brandon, this first question comes from Janice, and she is asking if you stay in your employer plan, can you still be denied coverage due to health if you wait until age 79 or beyond that?
To sign up for a supplement. I'm assuming
Uh,
she's talking for signing up for a supplement.
correct.
So if you've stayed on your employer group coverage and you've delayed your Medicare Part B, so as long as you've not activated your Medicare Part B while in that employer group coverage, once it that 6 month window triggers when you either sign up for Part B or turn 65. So if we haven't signed up for Medicare Part B yet because we're still covered under employer group coverage, then you will still have that 6 month window um, whenever you do sign up for Medicare at a later date.
But you can't be denied coverage.
Nope. So they will not ask you to go through health underwriting um, as long as you enroll within 6 months of signing up.
Okay, I actually just got another question that came in about the slides and the recording be, or will the slides and recording be distributed? Recording will be. We will take this presentation, we'll actually send it to LPL, have them run it through their compliance filters to see if there's anything that needs to be edited out. Usually we don't have any problems with that. And Brandon, I don't think you said anything that's going to have to be edited, so I think we should be fine there. But process usually takes a week and a half, 2 weeks, but then we will make that available to your financial advisor, and then they can disseminate it out from there. So if you don't see anything for, say, a week or two, just reach out to your financial advisor, and they should be able to get the presentation to you. If you want to rewatch it, share it with a friend, whatever the case may be. Had a couple of other questions, Brandon, and I'll ask you those just very quickly. So you mentioned poor Irma. Nobody ever really likes Irma. That's really a bad situation. And of course, you touched on this, but what we're talking about is if somebody earns too much in adjusted gross income, that could potentially push their Part B premiums up higher. And the question that came in was really around, is there any ways to avoid Irma? And I'll take a quick stab at this, but please chime in on it. This is something that we see working with clients on a financial planning basis. And, again, there is always that shock of, wait a minute, I have to pay more money for my Medicare Part B. But when you do start to look at the income thresholds, there are some fairly significant bands that you would have to hit before you really start to see significant increases. And the thing that we always try to counsel clients on is don't cut off your nose to spite your face. You might be looking at a total yearly increase in your Medicare Part B premium of maybe $1,000 or $2,000 or maybe even $4,000. And yes, that can start to become a significant amount of money. I don't want to minimize that. But if you're trying to decrease your standard of living to avoid that increase, you have to kind of balance those two. And it may not make sense to keep your income so low if you're having to scrimp and save on other things. It might make sense just to go ahead hit that threat, you'll go above that threshold, pay the increased premium, so you don't have to decrease your standard of living in other areas, when in fact you might have enough money to do it. So that's kind of again the financial planner answer. Brandon, I'll kick that over to you. Are there any things that you see people doing to try to avoid IRMA that work?
You know, this is where to kind of throw it back into your court, having a good advisor who's working with you in the years leading up to your Medicare eligibility makes a big impact. Because I run into folks a lot of, for example, somebody that sells a business. You're ready to retire at 64 and you sell a business, and then when you go to sign up for Medicare 2 years later, you had an exceptional windfall um, in the year that your Medicare Part B premium is being based on. There are ways with Medicare, if it's a one-time event, um, you can petition that Part B premium. Doesn't really answer the question she asked, is are there ways to structure it to avoid the Part B premium? It would be making adjustments to your taxable income 2 years prior to your Medicare eligibility. Those are something that I would more want to say, talk to your CPA or talk to your financial advisor to figure out, you know, how can we game what my bottom line tax, what my income that I filed taxes on was, um, that my Medicare Part B premium is going to be based on.
Yeah, and some things, just to throw out, to bring up with your financial advisor, these could be things like conversions to a Roth IRA from your traditional IRA. It could be things like potentially trying to build up more of a taxable investment base that you can pull from, as opposed to just pulling it all from IRAs and therefore kind of lowering that overall adjusted gross income. So again, all things to talk with, as you said, your CPA, your financial advisor, as you're leading up to this decision to put you in the best possible situation. One last question, Brandon, before we wrap up. And this was a question that really came in and asking about the Part C, or the Medicare Advantage plans. And it sounded like what you said before, is that if you enroll in a Medicare Advantage plan, that actually takes the place of Part A, Part B, and Part D. And just that the question was really just to clarify, was that what you're actually saying?
Yeah, so with a Medicare supplement policy, you have original Medicare. So Medicare is your primary. Your Medicare supplement policy is your secondary. It's covering that 20%. And then your prescription drug coverage is a separate policy covering your prescription drugs. On the Medicare Advantage side, it is all kind of wrapped into one policy. And, I started going, I forgot her actual question. It was
It was
the,
really just, does Medicare Advantage kind of replace,
oh, yeah,
if
yeah.
yeah.
So it is an alternative. So when you join a Medicare Advantage plan, you are enrolling in a private insurance option that is contracted with the federal government, but you are no longer covered under original Medicare. It's it's kind of confusing because you still have a Medicare card, you're still paying for Medicare, but you are essentially signing over the money sitting in an account, earmarked for your healthcare costs in the federal government. That money is being sent to that private insurance carrier to design a plan that, in most cases has a $0 premium, can offer coverage on things outside of what original Medicare covers. So when you see the commercials about, money back in your Social Security and dental, vision, hearing, food cards, those are additional services that they can build in because they're not stuck just covering what original Medicare covers. Um, so I hope that kind of answered it. It is, you are not on original Medicare when you're in a Medicare Advantage plan. You're in a policy that is being very strictly governed by original Medicare.
Okay, that makes sense. Well, Brandon, that was the last question. Thank you, everybody. Thank you, Brandon. Everybody have a great day.
Thanks so much. Really appreciate it.